Welcome to our second video in the video series of the respiratory protocol. We're going to talk about some of the symptoms that may be because your respiratory system is not working well. What could these symptoms be? Do you have dark circles around your eyes? Are your children irritable in the morning? Do they have a hard time waking up and getting their brains to function like they should? Those can be signs of not sleeping well caused by not breathing well at night. Last time we talked about allergens and quick tips and things that you may need to look at, triggers. And so if you didn't catch that, check that out. But let's hop back into obvious symptoms of respiratory issues. How about, does your child mouth breathe at night? Do you mouth breathe at night? And how is that affecting your health? Mouth breathing, what it does is it bypasses our sinuses. When we don't have air going through our sinuses, we don't produce as much nitric oxide. And so when we don't have the nitric oxide, we are more inflamed and our cardiovascular system suffers. Nitric oxide, it has a looping event. So when your body produces nitric oxide, your sinuses open up. And so if you're not breathing through them, then it can get worse and your body can get in the habit of having stuffed sinuses, especially when you lay down. So there are several things you can do to improve mouth breathing. One, you can get a jaw sling, which holds the mouth closed. And it's a Velcro strap that comes right under the chin. Hold it like that. You can still breathe out your mouth like this because your lips are not sealed. That's a good option for adults and some children. Some kids should have their airway evaluated by a qualified dentist and or ENT to see what kind of air restrictions are there in the sinuses. Maybe there's something obstructive that really should be addressed. Did you know at night when you're mouth breathing, when you correct that problem within the spans of 30 to 60 days, your IQ can go up a full 20 points. That's phenomenal. That's huge. That's the difference in an IQ of somebody who can attend a college or doesn't feel like they have the mental capacity to attend a higher education system. So something to think about there. Dark circles under your eyes, that can be an issue. And it may be triggering the idea that you're not breathing well. Crankiness, restless sleep, brain fog, difficulty concentrating, headaches, especially when you wake up. If you're getting headaches that are nailing you in the back of the head or right across here that don't feel like they're the sinuses, they feel like they drive into the head deep. That can be because your occiput is out, putting pressure on the bones in your head, and it manifests right there. That can be because you're dipping down into low oxygen. Excessive mucus and throat clearing. So you're trying to clear that out all night long. It's pulling you out of restful sleep. Feelings like you always are going to catch something like a cold or a flu. So these are some of the things that you're going to notice are driven from respiratory issues. A lot of people like to blame sinus congestion on allergies when really it's a infection in the sinuses, and it's not bacterial, it's fungal. Fungal infections are one of the things that sneak up on people and can be there all the time, causing a bacterial infection, a secondary infection to pop up and cause a sinus infection. Then you go to the doctor, get an antibiotic, and you do this once or twice a year, and you think it's only once or twice a year, but it's really a big deal because you haven't resolved the fungal issue. That is from a lack of probiotics in the nasal cavities that have probably been wiped out by a previous antibiotic, and we need to replace those. When we get to the product section, we will talk about how to take care of that. But maybe your situation is actually fungal in the sinuses, and people will experience symptoms of waking up and having a lot of mucus drainage, and maybe it's both. Maybe there's an allergy and maybe there is a fungal infection. All right, in our next video, I'm going to cover bad sleep from respiratory issues, low oxygen from respiratory issues, why that affects our cognitive function. And then we're going to go into foods that would be good for you to eat. We've already covered things to avoid, but good foods to have that can help with respiratory issues and opening up the lungs and the sinuses and helping improve that. And a tip and trick on how to produce more nitric oxide from your sinuses. The protocol guide on how to use the supplements to open up your airways and to address issues is called our respiratory protocol. You can find that at chformulas.com and it's a free email away, right? Why not? You can get it and start feeling better now. In the comments below, which symptoms of having not enough oxygen and respiratory symptoms surprised you? Or leave us a comment about other things that are respiratory related that you think maybe we missed.